Good morning, Dr. Castaneda.
Good morning, Marshall.
We are here in what I suppose could best be described as a grotto in this magnificent Dominican monastery in Antigua, Guatemala, and several hundred of your friends, pupils, colleagues, associates have gathered here celebrating the occasion of your 80th birthday, but are really here to honor you and to thank you for your many and immense contributions to the care of patients with congenital heart disease. We wanted on this occasion to talk a little bit about the history of the evolution of surgery for patients with congenital heart disease, a history in which you've played such an important role. My understanding is that you attended medical school here in Guatemala, and thereafter your path took you to Minnesota for surgical training. This was a time when exciting and important innovations in surgery in general and in cardiac surgery, then a very immature field, were taking place. Could you tell us a little bit about what drew you to Minnesota and what you were pursuing in that quest?
Well, as you know, I wasn't born in Guatemala. I was born in Europe. But I came here after the Second World War. To be honest, the major reason was because I had spent the entire Second World War in Europe, in Germany particularly. And at that time, people didn't really believe that the American troops would stay in Europe very long. And the only ones who could conquer that whole continent were the Russians. And I didn't want to spend the Third World War. So I came to Guatemala. First time I was 20 years old. I lost 2 years because of the war. The last year of the war there was no school, and the first year after the war was no school either. Anyhow, well, I had subscribed at that time to the New England Journal of Medicine, and I started to read about this heart surgery stuff. And I don't know exactly, to be honest, I don't know, but it sort of caught my interest. And I did have the opportunity at that time. There was a laboratory, dog laboratory, at the medical school in Guatemala. And as a mentor, I was a surgeon, older surgeon, who also became interested. He was actually a general pediatric surgeon, but he was interested in. So with him then, we would get dogs, and then through the ladies of the diplomatic corps, we got a donation to buy a pump and some oxygenators. And I wrote my medical school's thesis on open heart surgery, which actually wasn't so bad because that was, it was in '56, so that was pretty early actually. But all we did is we put the dogs on the heart-lung machine, had them on the pump for an hour, and then in some we opened the ventricle or the atrium and explored around, and then these were acute experiments, and then after the thing that was. So anyhow, I developed a strong interest. And then reading more about it, I found out that really what was the major point, mostly was the University of Minnesota that I read about. And there was an international congress in Guatemala in pediatrics at the time. And actually it was a curious thing, but I think it played a role because one of the people who, and then I was one of the simultaneous translators. And one of them was Dr. Louis K. Diamond from Boston, the hematologist, a pediatric hematologist. And the other was Dr. Jensen, who was the chief of pediatric psychiatry at the University of Minnesota. Anyhow, to make the story short, I had to translate his talk, and he started it with a joke. You know, Minnesota, they all know Scandinavians and stuff, and he had a joke about, well, the point is I didn't understand the joke, but I did tell people on the microscope, I said, listen, this guy is telling a joke, I don't understand it, but when I tell you, I have to laugh. So I said, okay, now laugh, and everybody just bursted out laughing, and that was a big success, the whole thing. He went back to Minnesota. Oh, well, he talked to me, invited me for lunch and stuff afterwards. And I did tell him that I was very interested. I had applied to Minnesota. It was the only place, by the way, where I applied for a residency. I didn't know we wanted to apply to 20 places or so at that time. What the hell did I know? I didn't know. So he went back and told Dr. Wang, and said, there's this genius guy in Guatemala who can translate Scandinavian jokes. And I'm not kidding. I think it played a major role in being accepted. Anyhow, I was accepted, and I started my residency in Minnesota on the 1st of January, 1958. At that time, I, of course, thought that that was already all done, and this was heart surgery, and that was it.
Yeah.